Let me record this in the computer. Welcome, everybody. We're so glad to have you for our Plan to Progress, Monitoring and Communicating Community Health Improvement virtual education session. Looking forward to having a bunch of folks with us today. I'm going to start us off with Pam. Go ahead and get us started.
Great. Welcome. So glad you all are here today. I see a lot of familiar names. Thank you for joining us. Today, our title of our webinar is From Plan to Progress, Monitoring and Communicating Community Health Improvement. And so that's going to be our focus for today, really about how do we map our community assets based on our priorities that we have, and how do we monitor our community health improvement plans. So glad you're here. I'll turn it over to Landon to get us started.
All right. Well, good morning, everyone. My name is Landon Campbell, and I am one of the two program managers overseeing this work, the other being Hannah Ho, who is also joining us today. So I'd like to take a moment to go a little further into detail about the work that Hannah and I focus on. It's Collective Impact and Action, which is a multi-component grant initiative funded by the Duke Endowment that focuses on strengthening the infrastructure needed to plan and implement public health activities across South Carolina. We have 4 key strategies that produce coordinated, data-driven action that reduces disparities and advances equitable population health across our state. The first thing that we do is strengthen data infrastructure. This provides the information needed to make informed, evidence-based decisions. We also align the China chip processes in the state. This allows us to establish shared priorities and coordinated goals across communities, including some of the stuff that we're doing today. We also train in the results-based accountability framework. This allows us to create a common language, common agenda, and translates plans into actionable strategies and measurable outcomes. And to round us out, we implement Clear Impact Scorecard, which allows us to monitor progress, increases our transparency, and drives continuous improvement going forward. And with that, I'd like to turn it back over to Dr. Melissa Fair and Pam Gillam to get us started with our content today.
As you guys, if you've been on previous webinars, you'll know that Melissa and I have been collaborating with the Alliance for Healthier South Carolina for a couple years now. The first phase was developing, conducting a landscape assessment, trying to really understand what is it the community health needs assessment process and community health improvement planning process look like for healthcare systems. We developed a report from that, and then these series of webinars have been built upon that. So today, our focus, as I mentioned before, is really on 2 things. One of them is, how do we map and communicate our assets that are currently exist in our community around our health priorities that are identified through the community health needs assessment? And then secondly, and also like using that information, how do we identify where there are gaps and look at new things that we could be doing that we think that will address those issues that we've identified? And then secondly, how do we track and monitor our community health improvement plans? So that's really our focus today. But we're going to get started with an icebreaker. Melissa, you want to get us started?
Sure. So thematically, one of the things that you will notice is that if you've come to all of these webinars, we almost always start with an icebreaker. And the premise behind this is that relationship building and knowing who your partners are when you're doing this community-based work through your CH&As or other similar work that you're doing in the community is really, really important. And so sometimes they seem super silly, but they also really help us learn a lot about each other. And so the one that we're going to do today is Would You Rather? And we're going to walk you through a series of scenarios where you're going to pick a Would You Rather using a poll. And so those are going to be, would you rather work on data analysis and planning, or be the person out there in the community conducting listening sessions and interviews? That could be as part of the CH&A or any process where your organization is collecting data. Would you rather facilitate a dialogue-heavy session with a small group or deliver a high-energy presentation to a packed room? Would you rather lead a hands-on workshop or moderate a panel discussion? And then lastly, just for fun, would you rather live in a world without movies or a world without music? And so that first one is up there on the screen for you to complete. It looks like almost everybody has done it so far, and we have got a more outward facing group today, it looks like. So our community listening sessions and interviews group, I am it depends on the day for me, like what mood I am. I'm an extrovert, but I'm also a data person. So depends on the day. Katie, do you want to move to the next one? Okay, this is the would you rather facilitate a dialogue heavy session with a small group or deliver a high energy presentation to a packed room? Okay, we're staying around 50-50. All right, looks like we're right at 50-50. So moving on to the next one.
Rarely exactly 50-50.
I know.
Cool.
Would you rather lead a hands-on workshop or moderate a panel discussion? I've done both of these. I actually really love both. If I had to pick one or the other, I really enjoy the challenge of moderating a panel discussion and figuring out how to weave together like that story across all of the participants. So I like the challenge of moderating a panel discussion.
You're such a good moderator too, Melissa. I love seeing you moderate panel discussions.
But looks like we got a hands-on workshop group, so more of that person-to-person interaction going on. So about 60-40. And then lastly, a world without movies or a world without music. Ooh, this one.
Wow.
Okay. I'm with this group. I am definitely a world without movies. I would rather have music. I can always read a book. But this one is pretty stark. We normally don't have it be this divergent. So this is a group that needs their music. All right. So I'm going to pass it back over to Pam to keep sharing the rest of today's webinar.
Great. All right. Let's get started and talk about mapping and communicating our assets around our public health priorities. So there's an organization called Health Begins that developed this map, and it's called the Upstream Strategy Map. It is a tool or a framework, as they call it, for developing really a portfolio of opportunities to address health inequities. So the way I like to think about it is a matrix where you can map out what's already existing in your community, then understand where there are gaps, and then have this conversation around what else could we be doing that might help better address these priorities we've identified through our community health needs assessment. And the reason why we're presenting this particular tool to you guys is because as part of our landscape assessment in phase 1, we really found that community health improvement planning by healthcare systems is a big challenge for them. It's like there's so much time and effort invested in the community health needs assessment process that when we get to this step, this part, it's the harder one because we're kind of tired, right? And also, things arise to the top in our around priorities where healthcare systems struggle in terms of like really seeing themselves having a role in addressing, whether it's it's not in their wheelhouse or they just don't have the internal expertise. And one of the things that we have stressed is in every single webinar around community health needs assessments and community health improvement planning is that there's no exact recipe in doing these. The tools and resources that you have really kind of dictates your approach to these processes. And today we're really focused on community health improvement planning. But one of the things that we really stress, especially as a best practice, is really about this is not just the healthcare system's role, that the community in general and the community-based organizations, and many of them who have the expertise, should be a part of this planning process and developing the action plan and implementing the community health improvement plan. So I want to stress that as part of the challenge that we've seen in terms of the community health improvement planning process and implementation of the CHIP. So this is what the tool actually looks like. Okay, this is a tool and this is how it's broken down. You have the levels of prevention, which are promotion, primary prevention, secondary prevention, and treatment. And then across the top is your levels of information. Is it happening at the program level or the service level? Is it happening at the system level, which if you think about it at like system-wide or organization-wide? Is it happening at the ecosystem? And so when we think about ecosystem, it could be like the particular community, like if you think about a particular geographic area that we're focusing on, that's very much defined by your group and organizations. Like, how do we define our ecosystem? Is it a zip code? Is it a whole county, et cetera? And then more at the societal level, where interventions or programs or policies we're putting in place really are widespread in terms of its reach. And so this is a blank tool, right? And then when we fill it out, when we start to map our assets or create our portfolio, that's where we're going, okay? So let's talk about what we mean by these definitions. So when we talk about levels of prevention, we're talking about promotion as that first level where we're really focused on promoting healthy environments and behaviors, okay? So this could be policy change, it could be interventions, it could be programs. Then we have primary prevention. This is that preventing disease among susceptible people, those individuals that might be susceptible to particular conditions or diseases. Secondary prevention is detection, early detection, and then treatment is reducing the severity of the disease. So those are the different levels of prevention. And then the levels of intervention I've already described, programmatic care at the program level, system, organizational wide, think about your institution in which you work. The ecosystem, this is about how we define our community, and then societal. So let's start. This is the step one, is the asset mapping that I mentioned before, where we are looking at ourselves as the healthcare system. What are the things that we do and where would they fit in here? And then also, what are things going on in our community? So we're introducing this tool to you so that when you think about how you could use it, yes, you could use it within your organization, but how could you engage your partners to really understand what else is going on in your community that are helping your individual or population wide in terms of addressing issues? Today we're really going to be focusing on food insecurity and chronic disease. And so you see in here how we've mapped, for example, in the bottom left-hand corner, provide medically tailored meals for low-income patients with diabetes to close health care inequities. So we're seeing that as a treatment at the program level. So that could be within the healthcare system, like, inpatient individuals who are having inpatient stays. Are we providing them medically tailored meals? It could also be a community-based organization that might be doing that, like a food share could be providing boxes that are tailored to individuals who've been identified with diabetes, okay? So then if you go in the far right corner where for promotion and societal, so like we're really trying to have a wide reach here, we're talking about cash transfer or community development and reinvestment programs as an example. So again, step one is really mapping out what's going on around in our community that might be addressing food insecurity and chronic disease. And then step two is who's doing it? And are there ways we can collaborate? And I actually know that we've had communities who've used this upstream strategy map to grid this, and it really helps visually see where there's opportunities for collaboration. It also helps you understand that there could be, it's not the healthcare system. Remember the challenge we said, healthcare systems sometimes struggle with this issue of, well, that's not our role or it's not our expertise. We can't really address food insecurity. Well, that's okay. Maybe it's not you leading, but it's someone in the community, like a community-based organization that's leading it, but you're supporting them somehow. And that support could look in a variety of ways. It could be community benefit dollars, or it could be other ways. It could be, are there ways to contractually work with them, that you send them referrals of individuals that need food assistance and you pay them for serving those individuals. Anyway, so this just shows you a way of how you can map out who's doing what. And then if you notice, there's gaps, right? It could be that we know there's more things that we need to be doing at the treatment level, at the programmatic level, or at the secondary prevention level, at the ecosystem level, like our community. But then there's also these gaps, like where we don't have anything. Some of these are blanks where we may want to be looking, okay, what else could we be doing at the societal level around primary prevention, and really begin thinking about interventions and programs that we could be doing in our community to really better address chronic disease and food insecurity. So this is a great tool again for mapping and communicating what assets we have, to identify gaps, and also to help figure out how we can look for opportunities for collaboration, or who can lead the work and other ways to support that work. So here's where we're going to move into the opportunity for you to be a part of asset mapping, okay? If you've been on our previous webinars, you've heard us talk about Big Old County. So this is our scenario that we're building off of. We've used Big Old County in previous webinars. And so I'm excited for anybody who's new today to join us on this journey. So to set us up for this exercise, remember this is really about introducing this tool to you for you to use in your communities. But we're going to all be members today of we all live in Big Old County, and we are community members of the Big Old County Coalition, BCC. Some of you represent community-based organizations. Some of you represent the Public Health Department and other human service agencies. And some of you represent a hospital, or the hospital, which we call Best Darn Hospital, BDH for short, or local clinical providers and other safety net providers like our community health centers and our free clinics. As I mentioned in our previous meetings together as the Big Old County Coalition, we've identified the major health priorities for our community, and you see them up on the screen. The 5 priorities we identified as part of our community health needs assessment were mental health, transportation, affordable housing, food deserts, and obesity. Once we identified those health priorities, we formed 2 working groups. One working group is focused on the non-medical factors work group. That also could be referred to as social determinants of health. And that group is really focused on tackling transportation, affordable housing, and food deserts. The other work group is focused on obesity, but that work group also said, you know what? Heart disease and diabetes, even though they didn't rise to the top in terms of our health priorities, we know that those are directly linked to obesity. So we're going to tackle those too, and we're going to call our work group Chronic Disease Work Group. Both work groups decided they're going to work together on the issues of food deserts, since that's a cross-cutting priority. So here we are today, both work groups meeting, because we want to map out Big Old County's assets to understand what's already going on in our community to address obesity, diabetes, heart disease, and food deserts, and also to identify gaps. We're going to use the upstream strategy map grid, okay, to map out those assets and to understand what we've got going on and to help us identify those gaps. We're going to break you up into small groups, and we're going to send you off with one of the 3 facilitators. I'll be one of them, Melissa is another, and then Hannah's our other facilitator for our groups. So when you go into the groups, you're going to be, we're going to share you a list of assets that the work groups have actually already identified that's going on in the community.
Pam frozen for everybody else, or is it just me? All right, welcome back, folks. They're going to auto close in 12 more seconds, so everybody else is going to get brought back in. But thanks so much for your participation in the breakouts. Sounds like it went pretty well.
Ours went well, I thought.
Great. All right, is that everyone back?
It looks like it.
Okay.
Fantastic. I will start sharing my screen again so we can debrief. And I think, I don't know why my video just went off and it doesn't want to come back on. Interesting. Okay, I'll just share my screen and I'm going to have Melissa lead
Oh,
us.
you're back, Pam.
Oh, good. Phew. I was like, that'd be real interesting having me facilitate the rest of the meeting and you can't see me.
Okay.
Go ahead, Melissa.
So we want to do a quick debrief before we move into the second half of the webinar, which will be about monitoring and tracking. And so my first question for you is, how did you feel about the process in general? And did the upstream strategy map feel like a reasonable way to work through identifying your community assets and addressing priority issues with your community partners? And I'll stop there and see. How did it feel? What did you think?
It's Darren. I do like the fact that it wasn't a firm right or wrong piece, that there is, and you could hear people's conversations and their perspectives, so things could be moved along or moved in different directions. But I also like that it's broken down into all those quadrants to at least elicit some response to make sure that we kind of fill in, at least put something in those places so we're not all just promotion or anything like that in any type of plan of attack for our big old community.
Mhm. I
I would
agree.
go ahead.
Go ahead. Who
I was
was
gonna say,
next?
I would echo Darren on that because it was interesting to see such a long list of all of the resources and the strategies and things on the right hand side, and then to kind of see how they fell and where we still had gaps that we could add support services and be more comprehensive and make sure that every layer has some support so that people are not getting to a certain point and then losing the support that they need to keep moving forward.
And
I
I
agree.
agree with Katrina and Darren, both of those. Absolutely. It was great conversational. And the word that stands out to me is power sharing. There's no right or wrong in that whatsoever. There's great conversation on where it could be or should be, but then you had the opportunity to shift or place it somewhere else. So there was no right or wrong. Great conversation and collaboration around it. I love it.
Yeah, I think that is one of the primary goals is that, when you see a list, you're not necessarily thinking visually of where things might fall. And, you might be doing yourself a disservice if you end up picking everything that is policy change and societal level interventions. While they have potential for huge impact, they're also really hard to do, take a long time. And so, you might be overcommitting yourself if you only pick things that you're trying to change policies. But then also down at the other end of the spectrum, if you're only picking, intervention work that is program and care, you're only delivering programs and services. And so your potential for population impact is lower. And so helping you visually see that, like, hey, let's pick them across the spectrum, I do think sets you up for more success in terms of breadth and depth of your impact. Could anybody see any challenges to using the map, or any maybe pre-work that might have to go into getting your partners ready to think about working this way together?
Yeah, I was gonna say it's challenging at the start, like trying to get the engines going and figure it out what the tool looks like and how to start the conversation. But I was also gonna say that like a smaller coalition that's been doing work might look at this tool and see where growth is possible, and vice versa. Somebody that's been doing high systems level things could look at it and go, oh, well, there's some minor pieces that we haven't done yet that we might could use to close the gap a little more.
Anyone else see some potential barriers or challenges or maybe adaptations you might make to this work if you were to integrate it into what you do?
If Robert Collins does not mind me jumping in to share what he stated, it exposes the missing coverage. Just visually seeing this, you realize what has not been addressed or covered. And he says, I think it's the system, yep, the lack of systemic support for people. And you don't realize it. You think it's out there, think it's been done, but when you certainly map this out like we have done today, there you see it. No, it hasn't been.
Mhm. I think that's a good point, Vanessa and Robert. The other thing that struck me is it could also help you see complementary interventions across the spectrum.
Oh, yeah.
So, like, you could see, okay, well, we're going to work on this part, and this is going to address the immediate need for the high risk population as it relates to food security. But now we can see that there is a way for these complementary interventions to like flow together, and you're working across the spectrum, but they all have synergy with each other. Are there any ways that you could see yourself using that just don't apply to the CHNA and CHIP only? Are there other types of work that your organizations or your health system do where this type of prioritization could be beneficial in your work?
Well, I would say, like, just from sitting in coalitions and knowing, like, the coalition lens, we've had times where, like, it's supposed to be a consensus decision within the coalition, but there might be grant requirements that require, like, PSE change or different things. So, taking folks' strategies and then mapping them in this way, I think could be really helpful because it allows the full coalition to visualize. Like, we're not saying that's a bad strategy, but our focus area is in this kind of second level. So it kind of creates that the language and the visualization for the full coalition to understand the way decisions are being made in those categories.
Mm-hmm. And we've got both Kimberly and Kimberly says creating alignment with other health partners potentially. And Mia said could be really helpful in coalition work. So it sounds like she agrees with you, Hannah. And then something that resonated with me that Vanessa said is about power sharing. I feel like this removes the personal potentially. We all know that when we are in coalition work, our organizations have different missions, different purposes, different priorities. And sometimes, making these decisions about what we focus on can feel personal. And so when you map it out this way, I do think it can kind of say, hey, we're removing the personal. We're just showing where it falls on the map, and then we're going to prioritize across the spectrum, can create that, address some of those power dynamics that Vanessa was mentioning. Well, I'm glad everyone enjoyed it. So I will, Pam, do you have any other questions for the group before we move on to the next part of the webinar?
No, I don't think so. It was a great discussion. Okay, so we've introduced you to a tool, the Upstream Strategy Map. We didn't make it up. Can't take any credit for it. You can go to Health Begins website, and actually, when you receive the PowerPoint presentation afterwards, you can look them up. We've used it here in South Carolina as part of the SE Roadmap work, as part of a food security learning collaborative. You have the information for you to go try it. So we encourage you, go try it out as part of your community health improvement planning process. Now we're going to switch gears. Now we're going to talk about tracking and monitoring CHIP implementation. And again, as I mentioned before, This was a challenge we identified as part of our landscape assessment, where we do a lot really well, work really hard on the community health and needs assessment, and now we're moving into the CHIP part. And it's really the community health improvement planning process, developing the CHIP, and then the implementation of the CHIP where we struggle. And so, what do we mean when we talk about tracking and monitoring? Well, those two terms actually have different meanings. So, when we're talking about tracking, that's the part where we're collecting data to really understand where are we now, what is our baseline, and then setting some goals for ourselves. And then on certain intervals, checking to see, okay, how are we doing in terms of achieving our goal? Okay. Or if we said, here's where we are and here are tasks that we want to finish or complete, how are we doing? Are we getting there? And then the monitoring part is really that I think of monitoring as continuous quality improvement. Like we're continuously monitoring. Are we getting activities done? Are we working through them? How are things going? And that really helps us identify when issues pop up. Like in tracking, we may be only looking at things at 6 month or 1 year intervals, like especially like data, right? Because we know that our data doesn't change that quickly, much less do we have access it as quickly as we would hope to, especially for larger, depending on what a particular goal is. And we have examples we'll show later. But monitoring is real important because it helps us identify where we may have run into like a bottleneck, like a challenge, and we need to address it so that we can keep moving forward and making progress. So I wanted to introduce those two terms to you so we're all on the same page when we talk about tracking and monitoring. So, why do it? It's really important for a variety of reasons. One of them is, again, it helps us with making decisions. Like I mentioned, if we run into a roadblock, if we have to make a decision, and so we can come up with decisions that will help us get past that roadblock or challenge. It helps us understand from a tracking perspective our performance. Like, are we achieving our goals? Are we moving towards that goal that we have 5 years from now? It helps with accountability and motivation. I know that if I am listed on a community health improvement plan, that I have certain tasks that I'm going to be responsible for, and I know that we're going to be looking at that community health improvement plan or action plan on a quarterly basis. I, as a community-based organization that's responsible for certain activities, I'm gonna want to make sure that I get those done. So when we get together, I'm not getting called out in the meeting, right? Like I want to be part of this and I want to help with improvement. So I'm going to make sure that I'm doing my part. So that's where accountability comes in. Early detection and prevention. Again, this idea of how are we making sure that we're addressing challenges in a timely way, that we're not waiting 6 months from now when something's gotten so bad and we could have addressed it before. It creates transparency and visibility. So having a visual community health improvement plan that we can look at together, just like that upstream strategy map, we all looked at it together. We're looking at that action plan together and see who's responsible for what are our goals in terms of like our timelines, et cetera. And it really also helps with resource management. So one of the examples that I share is like I work with a group and we had a lot of resources like funneled to one particular program, and we realized it wasn't making a difference. Like, and so we decided, hey, we need to pivot here and change and put those resources elsewhere. And so that's where a community health action plan, improvement plan, and action plan really can be helpful in terms of are we using our resources wisely? It also can help you identify opportunities to pool resources or blend resources or braid resources. So that's also a benefit. So again, what are we tracking and monitoring? It's our action plan, right? That action plan where we have, and here's an example of all the things you would see in an action plan. So that priority area would be one of your community health priorities that you've identified. So for Big Old County Coalition, it would be priority area mental health, transportation, food insecurity, obesity. That's what we would see as our priority area. Then we as a group would come up with what are our goals, and then some objectives and intervention strategies associated with that. And we mapped our interventions, right? So we know where those might go, but then we might have new interventions too that we want to start implementing. So these are the items that would go into an action plan, and that's what we would be tracking and monitoring as Big Old County Coalition. So, different ways to track and monitor your CHIP implementation. So, there are software solutions that exist out there. Here's a list of them. You may or may not have heard of some of them. Some of these are just like like management software programs that could be used across for a variety of reasons. Metopio, in particular, targets specifically to community health needs assessments and community health improvement plans. And Clear Impact is one that we're using in South Carolina that's as our way of monitoring. It's more from like a tracking standpoint, using are we achieving goals that we've identified. Um, and we're using that as part of, Landon, am I saying this correctly? As part of the SHIP, the State Health Improvement Plan, are we using Clear Impact or are we using
We
it?
are.
We are. Okay, great. Thank you. Oh, I got it right. Yay. Okay, um, so these are just different software solutions that you could use for action planning. Now, if you don't have any money, because I don't have any money to buy any of these software solutions, a good old fashioned Excel spreadsheet works just fine, right? And like you could have that out on a potentially on a Google Drive. So different organizations would have, and healthcare systems and safety net partners would all have access to it. And so you will get a copy. We will send out as part of the materials and resources that we're sending out to you of an Excel spreadsheet that we have devised as part of this that you could totally steal shamelessly and use and adapt and use if that's something that you would like to do. But again, not all of us have money to buy a fancy software to use for this. So Excel works just as well. I am a big fan of Excel for many, many things. So this is just an example of one. So if you remember on our, when we were during our exercise, there was a new intervention or program around creating a healthy vending policies. That one fits under here if you look. Specifically working with the school board. So our Big Old County School Board, we want them to create and implement a healthy vending policy. So you noticed in terms of our lead organization, we have the Department of Public Health who's researching different policies that we could present to the school board to promote them for adopting it. And then we're working with the Best Darn Hospital as the communications lead to help adapt that. And we have other partners we could be working with, like the University of South Carolina and the County Council and the Institute of Medicine and Public Health. You see how you can fill this out to really go to the school board and push for this healthy vending policy. And then notice this is our tracking tool. We've come up with goals for us for fiscal year 30, and we happen to have some baselines listed here that we're trying to move the needle from 18% in fiscal year 2025 to 2022%, or to fiscal year 30, 22%, where we see 22% of our youth are consuming 5 or more servings of fruit and vegetables daily as measured by our school-based survey, and that 100% of our schools have a vending policy by 2015. So again, these are just an example of how you can just use good old-fashioned Excel to create an action plan to help you monitor the activities that you're doing related to helping improve a particular health priority you've addressed. Now, another tool I want to introduce to you. So, a lot of folks say, oh, especially with the healthcare systems we've worked with, what does a community health improvement plan look like? As I mentioned to you earlier, there's no one recipe. Like we talk about banana pudding on all these calls, there's lots of different recipes for banana pudding, right? There's cold banana pudding. There's cooked banana pudding. There's banana pudding that you use banana pudding mix or vanilla pudding. What we're pushing with you guys is you figure out what recipe works best for you, but there are recipes, banana pudding recipes that win the blue ribbon. And so on these calls, we're trying to push the blue ribbon recipe. And a lot of that is around how can you create community health improvement plans that are not just healthcare system centric, but are also engaging your community partners. So the Kansas Health Institute actually has a CHIP handbook, okay? We'll send out the PDF version of this. I really like this template. The reason why I like it is it's a toolkit that really walks you through step by step in developing a community health improvement plan, like the action plan, right? So you may have your community health improvement plan that you send off to the IRS healthcare systems. I'm talking to you that checks that box, but like an actual action plan that where you're really taking you're saying these are the things that we're going to do and the new things and who's going to be involved. That's what this handbook can help you develop is how do you engage your community-based partners and develop a community health improvement plan that involves all the different assets and resources we have in our community to address our health priorities we identified as part of our community health needs assessment process. So just to show you in the community health needs or in the community health improvement plan, they have worksheets for you that are just real specific templates that you can use to help develop. So here the example is obesity, right? That's what one of our work groups is working on. And so one of our goals is increasing the consumption of healthy foods for our big old county residents. And so one of our objectives we identified is youth healthy food consumption. And the two intervention strategies related to that is going to the school board to push a healthy vending policy and developing education and awareness efforts regarding the impacts of sugar sweetened beverages through pushing our organizations to adapt wellness policies. And then objective 2 is county adults are consuming the recommended amounts of fruits and vegetables. And so if we were mapping these interventions into our upstream strategy map, where do you think we would put those? So looking at these interventions, any thoughts? Anybody want to take a stab? We're not going to kick you out of the meeting if like it's not perfect. So I might push the school board implementing healthy vending policies and then organizations adopting wellness. Those would probably go at the system level or the organizational level, and then maybe at the promotion level, right? It was trying to promote healthy behaviors. So that might be where I would map these. And then notice you would come up with some outcome measures. So those outcome measures are really important, right? So like, how do you know you're making improvement? So that's why those are included too on the spreadsheet. So that's like kind of the first step of that. Then they have the action plan where they map out all of the key tasks and activities they're going to do to help implement. And so you see the research model policies, adopt a policy, set a meeting with the school board, propose the policy. So all the different, and then who's going to take the lead in terms of that work. And this comes straight from the Kansas Health Institute examples. And then it shows you like higher level. This is the tracking part. So our baseline is 17%. Our target date to hit 22% is December of 2016. How often are we going to look at this? Yearly. We can get that information from our health department through a school survey. And then it shows you the results. In 2014, we hit 18%, 2015, 18%, and 2016, 20%. So again, these are great templates for you to use as part, and you'll receive a copy of the handbook, a PDF version of the handbook. Also in this, I'll show you on the next slide in just a second, we have a list of bunch of different resources and the website links for you to go to them. All right, to kind of wrap up this portion of our webinar today, Tips and things to consider. One of the things that we've stressed on almost all of our webinars that it's healthcare systems are not the sole owner of improvement on health outcomes, right? They can't do it alone. Yes, they have for their CHNAs and their chips, they are regulated by the IRS. They have to turn in a CHNA and they have to turn in a chip. But if you're really going to make improvement in your community on addressing the health priorities, you've got to work as a community. So it's not just healthcare systems, it's all of our different partners, community-based organizations, health and human service agencies, our safety net partners, all of them need to be a part of addressing the health priorities. And so it's also really important to recognize, and you can do that through the assets mapping, is that there may be other organizations who do a better job of addressing a health issue. And so how can we support those organizations? And that's one of the things, and this was mentioned, which I really appreciated you saying, was that being able to visually see and everyone looking at the same thing really helps you identify those opportunities for collaboration and recognizing who can lead the work and finding opportunities, as Melissa and Vanessa mentioned, like how we can align resources. Ask for resources. So this is healthcare systems. One of the things we've been talking about is like we recognize how underfunded conducting CHNAs and CHIPs are within your organization. Like it's just, we recognize that, right? And so like having our leadership within our healthcare systems really understand what it takes to do this kind of work is really important. We've had meetings with healthcare systems to talk about how could you align your community benefit dollars to your health priorities, right? Some healthcare systems do that very well, but also when we're working with our community-based organizations, what could that look like if we are looking at helping better support through dollars? Do we have organizations that have strong communications and marketing that could help us with getting out information on all of the good programs and interventions that are going on? Are there opportunities to co-locate services, right? The really understanding what our assets are provides us the opportunity to, again, align. And it's not just money, right? But it could be other ways. And co-location of services is just one example. Community health improvement plans and action plans should be reviewed regularly. This is not something you create and put on shelf and let it collect dust. I would suggest an action plan be reviewed at a minimum every 6 months, but ideally quarterly, especially if there are activities and tasks that are supposed to be occurring within a quarter. Again, that helps address accountability. It helps it helps you identify when there might be challenges that come up. And it helps you do better decision making when you're looking at things together. It really helps you make progress in terms of addressing the priorities in a very strategic, systematic way. So, and then your outcome measures, those are your goals, right? And then you need to look at, we suggest annually because it's really hard for some goals to move the needle within 3 months or sometimes even 6 months. So really thinking about how often do we want to really revisit and look at that data? And it may be that annually, or sometimes it may be every 2 years that you, depending on access to the data, that you can actually really look at those outcome measures. So these are tips and things for you to consider as part of the action planning and community health improvement plan implementation process that we really encourage so you achieve that blue ribbon banana pudding recipe. Okay. Do you have any questions, thoughts, comments, anything else you'd like to contribute around this conversation around community health improvement plan implementation and developing action plans and tracking and monitoring the work.
Only thing I would add is like this series, you have made things so much more intentional of what all the different steps have been, and um, being a part of some of the things here where I'm at is I'm excited for the next iteration because there's a lot. So
Great.
yeah.
Good. Darren, I appreciate that feedback. I mean, one of the things that we say to folks that like healthcare systems in particular have these dates, where they're like, we have to have this turned in to our board by this date for approval and then submission to IRS. And then it's like, phew, it's over. Well, really, it never ends. Right? Like the chip implementation is going, and then there's the planning that needs to begin sooner than later for the next iteration of the CHNA process. So I appreciate you saying that, and thinking about like, okay, when do we need to like really start this up, and how can we, through good, quality chip implementation, put us in a better place for that next iteration of the needs assessment. Any other thoughts or comments? All right. So again, you'll be sent out this PowerPoint along with the Community Health Improvement Plan toolkit, the handbook from Kansas Health Institute, as well as our handy dandy Excel spreadsheet that you can throw in the trash, or like I said, steal shamelessly. I love to steal other people's stuff. I do like to acknowledge it as well, where I got it from. But again, it's for you to adopt, adapt, or abandon, as we say in PDSA cycles. There's all these other tools. If you are a member of the National Association of City and County Health Officials, they have a lot around community health improvement planning resources, the Kansas Health Institute. The Community Health Improvement Navigator, which is also great through the CDC. The Navigator is defunct, but you can find it in the archives, so it's still out there somewhere. And then there's also the Community Health Prioritization Toolkit that has some information around community health improvement plans implementation. So those are some materials for you. And I want to thank you for being here today. I'm going to hand it over to Katie and to Landon to wrap us up.
Let me get myself off mute. Thank you so much, Pam. Everybody give snaps or use that fun emoji thing to say thanks to Pam and Melissa for this great content. This is our last in our current series. We will have a new series coming up starting in the early fall, we believe, for additional information around Chinas and chips. Yay, love the hearts and love the claps. As you can see on the slide here, you can use the QR code to do the very important meeting evaluation. You can do that with your camera and go immediately to your phone, or please use the link in the chat and just take us literally seconds, minutes just to do it. And it merely helps us with what we need to do further. So we got some snaps for Pam in the thing too. Appreciate your enthusiasm and your ability to simplify complex concepts. We do love it. So thanks to all of you. Please fill out that survey. And for the end, I'll hand it over to Landon.
All right, before we go, I want to thank you all again for your attendance today in our session. If you'd like to engage in other Alliance activities, including some of our virtual learning sessions in the future, we do have one upcoming conference that's going to be the 9th annual Live Healthy SC conference. We're going to be hosting that in November. I've added the link for more information in the chat, and it'll also be in your follow-up email. And I'd like to say one more time, thank you all again for your time, and I hope you have a wonderful rest of your day.
Thanks, everyone.
Thank you.